So what are the ICU enteral tube feeding liquid challenges in 2021? What do you as doctors and nurses need to know about these challenges? Let's begin with saying thank you to the medical heroes at MedStar Georgetown University Hospital. I want to say thank you to all the hospital staff, but especially the ICU team. Extra thanks to all the doctors and nurses that work long hours and long shifts to assure continuity of care to the vulnerable patients in the ICU. Those of us who have loved ones in your care deeply appreciate the extra stresses and burdens that this pandemic must have imposed upon your personal lives. And we thank you deeply for the personal caring and attention that you continue to provide to our loved ones. So, what is an ICU patient's wish list right now? What are they looking for? And as you can see in these little boxes, the range of concerns begins with the medical critical items and goes down to things like, once we get over the hump, once we've gotten me stabilized, can you nourish me for optimum nutrition? Can you nourish me for optimum recovery? Can you restart my digestion? Can you restore my circadian rhythms? And can you restore my hope and trust? Those are all big challenges. Let's face it, very big challenges. But it's the wish list, and it is what it is. It's a wish list. So, unfortunately, today's patients don't live in a vacuum. There was a time when doctors were taught that patients simply would not adhere to dietary changes even when strongly recommended by the doctor. Times have changed. Many of today's patients are perfectly willing to modify their nutrition and lifestyle to achieve better health and to feel more energetic. So, in the meantime, there are numerous MDs that have become media personalities and best-selling authors, and they've informed their readers to a high level. The level may be so high that it may exceed what a practicing MD may have had time to absorb outside their practice of medicine. I mean, the time constraints on medical community today are undoubtedly very difficult, and it's hard to keep up with all the new information that's coming out from the various labs working on nutritional topics. So well-informed patients do undoubtedly present both a challenge and an opportunity today. So here's a list of some of the doctors who've become best-selling authors or media personalities that your patient may follow. Martindale, Lustig, Gundry, Hyman, Perlmutter, Knob, Mason, and Eads. You should become familiar with all of them. In addition, DiNicolantonio, Levy, and Walsh, again, names you should be familiar with. Patient concerned. Do the food products you use in the ICU nourish and restore me? Well, let's face it, there are two big, giant companies that provide most of this product, Abbott Labs and Nestle. And as you can see, we're talking about billions of dollars of revenue every year from these kinds of products. So, if I'm a patient and I've read some or all of those doctors that are media personalities or some of the best-selling books they've written, what ingredients might I question in a typical ICU feeding tube formula? Well, you can see on the right side a list of common ingredients. You can see what they are. And of all of them, maltodextrin seems to be the most utilized and most common, followed by sugars, in every form and every shape, size, and form. Polyunsaturated seed oils, casein milk products and protein, soy ingredients, and carrageenan. So, one by one, maltodextrin, which is typically made from cornstarch, is a thickening agent, but it has the highest glycemic index of any carbohydrate, period. So you can see these maltodextrin has a number of things that need to be questioned and rethought. Patient concern, sugars, particularly fructose fraction. Robert Lustig, please watch his videos. One should automatically be limiting their sugar and thinking twice before using it. So the fact that it's present in so many of these products is something your patients might question. Also, polyunsaturated seed oils. Now the most common ones are canola, corn, cottonseed, soy, sunflower, safflower, grapeseed, rapeseed, and rice bran oil. So these ingredients seem to be turning up a lot as oxidized LDL in the bloodstream, which is not a good thing. And there's new evidence that they may actually interrupt the fat storage signaling system. So the fact that these are in almost all of these products is of concern. Undoubtedly they are there because they are much cheaper than high quality natural oils from real food sources. Casein milk protein, it's a very large, difficult to digest molecule. Milk can be divided into casein type A1 or A2. A2 is from certain European or heritage breeds here in America, and it's very much easier to digest than the typical A1 that is found on grocery shelves. So not only the amount of casein is questionable, but so is the type of casein that's in these products. So don't be surprised if your well-informed patient wants to know why they're there or how can they be eliminated. There's not much information about the fibers that are going into these products, but please be aware that some patients are sensitive to the fructooligosaccharides that are known as FOS, which ferment in a healthy way and are quite helpful normally, but some patients are extremely sensitive to them. They can cause bloating and discomfort in some patients, and you definitely want to keep track on those symptoms. It would not be good to have a state of constipation and a state of bloating going on at the same time. That would be a very bad thing. So again, monitor the amount of FOS that your patients are receiving. All right, moving on. The use of feeding tube liquids often follow antibiotic medicines that can affect gut bacteria. The newest trend is to offer patients probiotics, or even in some cases, in like C. diff infections or outbreaks, fecal transplants have been used to reseed the healing bacteria. Obviously, these are not typical policies used by hospitals, but in 5 to 10 years they may be, so be aware that your patients may ask about those. The question might come up is, well, hey, why aren't there any prebiotics or resistant starches in these foods? What about why are there no omega-3 oils? I thought that was supposed to be good for patients. Also, the recent ketogenic trends and popularity of ketogenic diets may cause some of your patients to question the ratio of calories of carbohydrates coming from carbohydrates that might be too high. And the final question might come up is, well, should I really be eating this stuff or feeding this stuff 12 hours a day? Naturally, when I'm at home and I'm well, I might only be eating 8 hours a day or maybe up to 12 hours a day, but I do give my digestive tract a rest. And if I'm in the ICU, why should I be, is it necessary to feed me 24 hours a day? Well, on the flip side, what if you're a patient? What should you be doing to inform yourself about the situation? How can you find out exactly what's being done to your loved one in the hospital? Well, you can ask the ICU doctor exactly what Enteral formula choices are available. You could ask the ICU nutritionist to discuss or inform you of their current choice and what other choices might be available. Once you find out what's being used, you can look up that product online. You could do a comparison and see if you find that there are other products out there that might have ingredients that you are more comfortable with. You may wind up with a situation where the hospital just doesn't have the product you want in their supply chain, and you may wind up having to obtain the product yourself and either absorb the cost or work with your insurance to cover it. But it could be a little bit, it's a little bit like you want what room service is offering you in the hotel may not be to your liking, and what does it cost to bring in food from an outside restaurant. It's that kind of thing. Don't be surprised if you meet some resistance or some speed bumps along the way to getting exactly what you want. So another patient concern is, are your ICU practices going to restore my circadian biorhythms? As stated before, you may have your patient, they might be on a particular 24-hour support for a period of time. However, I think what's coming out in the popular medical publications and the bestsellers is, it's pretty widely known that almost every organ in the body has its own internal clock, and that they all synchronize with a master body clock. So the question could come up from one of your patients, what are you doing to get my biorhythms restored? You know, the sun comes up and sets pretty much the same time every day. Can you time my sleeping cycle to where I fit right in with the natural solar pattern? And finally, there's a question about information flow, and it has to do with, how do you restore my hope and trust while I'm in the hospital and afterwards? You know, doctors and nurses can't predict the future, and people are always asking them to say, well, how long would you expect this or that to continue? And the doctors will always pass that question off as best they can. So the families or the patient will then they'll go to Google and they'll get some ideas on typical timing, and that may help them a little bit, but the doctors and nurses' reluctance plays off of what they can find on Google as common knowledge. It kind of undermines the credibility of what the doctors are saying. So here's a generic question for hospitals. How can you efficiently provide pertinent therapy information with some reasonable timelines for outlines, and then simultaneously caveat that information to prevent misunderstandings or lawsuits? In other words, can you give a patient with a particular diagnosis some indication that, well, cases like this can typically range from 3 weeks in the ICU to 6 weeks in the ICU. And that can change. That's obviously dependent on a great number of factors, but that will give you some kind of indication of where you're going. So a response like that gives them some information, but it's sufficiently caveated. And it would not be at all unreasonable for the hospital to have something online for each of those particular diseases or conditions that they're trying to treat, particularly those that are common. So I think there's an opportunity, in other words, for hospitals to use a website to provide that information in such a way that they don't take on an unusual amount of liabilities, and also to relieve their doctors of repeating the information constantly. So that's a food for thought for the hospital. Well, that concludes this presentation. I want to thank everyone for watching. Please leave any comments or suggestions you have. Please like or subscribe if I haven't wasted your time. I do wish all of you the best. If you have or ever have a loved one in the ICU, and if you are ICU staff or hospital staff, I want to again thank you for the life of giving and healing that you have chosen. If you want to stay tuned, I'm going to present a little bit of further information on each of the medical doctors that are widely publicized or well known. Just in case you're not familiar with them, please stay tuned. Otherwise, thank you for watching. All right, Robert G. Martindale is a Nestle Fellow, and he has a YouTube video that I caught that's really wonderful. It's called Inflammation Is the Gut the Driving Force of Systemic Inflammation. And Dr. Martindale has been a surgeon for a number of years. He's won numerous teaching awards. He is very well published, but he's a practicing MD, and this is sort of his side thing. It's not a major line with him. But anything you can find by him on YouTube or anywhere else is well worth your time invested. Robert Lustig. He is the well-known MD who is he's an endocrinologist who specializes in childhood obesity and diabetes. And he's, if you can look at this, you'll see he's extremely well educated. He is probably one of the most entertaining speakers you will ever watch. And I would say the best thing he has several videos, all of them are life-changing, but I would recommend Processed Food, An Experiment That Failed as a good place to start. Again, he's a hero in my book, and hats off to Robert Lustig. Stephen Gundry. Now, he is a best-selling author. He's a little bit controversial. He was a former cardiac surgeon, and then he split off his practice. He stopped essentially repairing hearts and tried to get to the basic cause of heart disease. And he has a specialty practice where he's curing people with difficult diseases using primarily nutritional changes to promote health. So he has written a number of books. He's all over YouTube. He has a weekly podcast. He's a media personality. And I would tell you this, his big topic that people sort of are most concerned with is his identification of lectins, which is a protein found in wheat and grains that he thinks is very inflammatory and causes problems for people. So he will find, though, that all of his books have the word paradox in them. And if you read them, you'll find that he is extremely well read and well researched across all food types. And I would urge you to pick up his latest book, The Energy Paradox, and see what you think of it. Mark Hyman, he is another YouTube media personality. He's a functional doctor, meaning he tries to get to the underlying cause of various health conditions. I recommend you watch his video on YouTube called Health Expert Reveals What Foods Are Killing You and How the Food Industry Lies. It will give you the background that you need on the food industry without having to do a lot of research. David Perlmutter, Why You Desperately Need Carbs. He's a well-publicized neurologist, and his big thing is how wheat and grains are undermining our brain health. Chris Knob, oddly enough, he's an ophthalmologist, but his video, Diseases of Civilization, Are Seed Oil Excesses the Unifying Mechanism, is extremely well thought out and very much worth watching. Paul Mason is on YouTube. He's a doctor in Australia. He primarily uses a low carbohydrate diet, and he's a sports and exercise medicine specialist. So he deals with a lot of athletes. And he's very well informed about how you can look at lab tests. If you're on a high-fat diet, like a ketogenic diet, your lab tests are going to obviously become a little bit different than someone who's on a high-carb diet. And he's very good about telling you what you should be concerned about and what you should not be concerned about. Thomas Levy, he has several videos out there, several books out there. He's very well published. He's a board-certified cardiologist, but his best-known work, you can find him on YouTube under Vitamin C, Antidote to All Known Toxins. He is extremely well informed about vitamin C, but he also questions whether root canals that were done historically might be harboring some undetected infections that are undermining health. So he's very much worth investigating and watching. Okay, so those are some notes about the doctors, and then finally, if you're still with me and you want to know how you might go about making comparison of products, well, I will show you what I did, and I will also tell you that looking back on it, the fastest way to get through this and find what products you're interested in is to either get on Google or Amazon and look for, search under healthy enteral formulas, organic enteral formulas, things of that nature that will bring up products that claim to have the cleanest ingredients. Then you can look at those as a benchmark and go back and look at what Nestle and Abbott and others are offering, and you can see the differences and make choices based on a wider range. For example, I started out and I just compared Nestle to Abbott, and I still wasn't satisfied. And it was only then that I went and checked on Google and Amazon and found other alternatives. All right, so what I did is I started out with the Abbott products that I knew my hospital typically like to use. And here's a list of them. And I read through what each of these summaries had. Then I went on and I looked at the ingredients for each of them. And then I created this table, and the table comes in 3 sections. And you can see how I broke down each and every one. The most important table that you can collect, though, is just to copy and paste the ingredients in each of the products. And you can see from there exactly what these are, obviously in order of quantities. So in this product, corn maltodextrin right up top, corn syrup solids, that's sugar, sodium caseinate, that's those milk proteins, canola oil, that is a processed seed oil, corn oil, and here's the FOS ingredients. Here's some soy protein isolates. You can see they're not hiding them, but unless you are aware as about what each of those are, you might think, okay, that's all fine, everybody's using the same thing. Well, actually, no, they're not. And again, you can make the comparison for yourself. So anyway, that's what I did. That's what you can do. And I want to wish each of you that stuck with me best of luck and Godspeed on your journey. Thank you for watching.